let's cover why treatments don't hold. The most common reason I see treatments not holding is because in the body there is instability. So what does that even mean? Why is that the case? Well, if you know my content, you know my order of stability is nerve, muscles, ligaments, joints. I repeat that every day. Nerve, muscles, ligaments, joints. What is that all about? Well, nerves feed muscles, muscles stabilize for ligaments, and ligaments stabilize joints. So now, where does this instability come in? Well, instability is going to come in between these two structures. So if muscles lose integrity or ligaments lose integrity, then the body becomes unstable and therefore treatments don't hold. So let's look at this. So why would a muscle become less functional? And that is because as we look up here where my focus tends to be, and that is nerves. Nerves feed the muscles, and if the nerve is affected, then the muscle will become impaired and what we call inhibited, and it loses its integrity. Ligaments also can lose integrity. Now in general, there's 3 reasons for what we call ligament laxity. I'm going to cover that in a future video when I go deeper into joint instability. But for the sake of our conversation to look and say, okay, we need to look at these 2 structures to understand why those treatments aren't holding and why the body is unstable. And this is why I always say there is an order. We need to look here first. It's not the only thing. Of course, the whole order is important to treat, but we want to look here and we want to look in this order to restabilize the body. So then we can look over here where we see, okay, if we can restabilize and achieve stability in the body, we want that first. And then, in my opinion, the way that I progress is then we can treat the pain. That is then when exercise becomes appropriate. But if we are not stabilizing, then the treatment geared toward pain doesn't hold. We want to stabilize, and again, up here, we want to do nerves first, and then go through the sequence to achieve stability, address the pain, and recondition.